Good morning, and thank you very much for joining us today. My name is Diane Byram, and I'm the State Director for Protect Our Care, Michigan. Protect Our Care is leading the fight to protect and strengthen health care for millions of Americans and to stop the relentless attacks on the Affordable Care Act, America's health care system. Today, we're going to discuss two topics that are very important to Michiganders. First, access to quality, affordable health care, and second, the cost of prescription drugs. Health care should not be political. It's very personal. President Trump and the Republicans in Washington, D.C. are doing everything in their power to sabotage the Affordable Care Act and destroy America's health care system, to turn it into total chaos. Chaos for 4.1 million Michiganders who have pre-existing conditions who would be at risk of losing their health care. And even more chaos for Americans who rely on prescription drugs to manage their illnesses. It's never been more important to have this discussion than right now in Michigan and across America. Recent polling conducted by the Public Policy Polling revealed that that just how unpopular the president's positions are on health care. So here's a few of the findings. Health care is the most important issue for 68% of Michiganders who are deciding who to vote for president. More than 80% of Michiganders support allowing Medicare to negotiate for lower prescription drug costs and drug companies. Plans to cut Medicare are opposed by 72% of Michigan voters, and over 70% of Michigan voters oppose the president's lawsuit that would strike down the Affordable Care Act as unconstitutional. At a time when skyrocketing drug prices are causing families in Michigan and across the country to choose between getting their medication or paying their rent, putting food on the table, legislation in the U.S. State House is a breath of fresh air. Democrats in Michigan and Washington, D.C. have been on the front lines to fight for lower costs of prescription drugs. Joining us today to discuss these very, very important topics are Representative Abdullah Hammoud, Representative Padma Kuppa, Representative Vanessa Guerra, and Representative Kara Hope. Now I'm going to turn it over to Representative Hammoud, who will discuss H.R. 3 that was introduced in the U.S. House by Democrats to reduce the price of prescription drugs for every American. That legislation is currently awaiting a vote in the U.S. Senate. So Representative Hammoud.
Thank you, Diane. And thank you all so much for being here. My name is State Representative Abdullah Hammoud, and I have the honor and privilege of serving Michigan State House District 15, comprised of my hometown, the city of Dearborn. Today, I'll share some details about H.R. 3, the Lower Drugs Cost Now Act, an aggressive plan that's passed the U.S. House and is currently awaiting a vote in the Senate. Too many families in Michigan and across our nation are staying up at night worrying about the rising costs of the prescription drugs. Prescription drugs shouldn't be so expensive that patients have come to a position where they are forced to ration their doses. Under President Trump, drug prices have soared. Under President Trump, the prescription drug companies and the middlemen known as PBMs have been given tax breaks. Under President Trump, they are all held less accountable and there is less transparency. Let me share a few shocking figures. In 2019 alone, prescription drug prices increased at a pace that's 5 times the rate of inflation. And the prices of more than 3,000 drugs were affected. The cost of insulin alone has tripled over the last decade, causing many individuals and many families to skimp on or skip doses altogether. This needs to change. H.R. 3 will give Medicare the power to negotiate with drug companies for lower prices for all Americans, regardless of how they're insured, just as we do with the VA. H.R. 3 would stop unjustified price gouging for thousands of medications, including insulin, which has tripled in price over the last decade, and it will penalize drug companies that fail to reduce their prices. Data released by the Congressional Budget Office confirms that H.R. 3 will reduce negotiated drug prices by as much as 55%, which will save patients and taxpayers across America an estimated hundreds of billions of dollars in prescription costs over the next several years. Big drug companies have spent billions to rig the system so they keep prices high and profits going up. But that will all come to an end with the passage of H.R. 3. The U.S. House did their part in passing this resolution, and now the ball is in the court of the U.S. Senate. And we urge the U.S. Senate to give H.R. 3 the time it deserves and the vote it deserves without delay. The fight to reduce the cost of prescription drugs isn't only happening in Washington. Right here in Michigan, my colleagues and I are fighting tirelessly to combat the rising cost of prescription drugs for Michigan residents each and every single day. Later, you'll hear about our Michigan State House Hope Bill package, Health Over Profits for Everyone, that much like H.R. 3 will bring real relief to Michigan families. With such uncertainty and the constant fighting at the federal level, it's critical we cement these protections into state law. Thank you.
Thank you very much. Now I'm going to turn it over to Representative Padma Kuppa, a member of Governor Gretchen Whitmer's Prescription Drug Task Force, to discuss this effort right here in Michigan. So, Representative?
Thank you, Diane. I'm State Representative Padma Kuppa, and I have the privilege of serving Michigan's 41st House District, representing Troy and Clawson. I'd like to start by commending Governor Whitmer for her leadership on this issue that affects so many Michigan families. I was proud to hear her speak so boldly during her State of the State address about the actions she is taking to address this issue at the state level. Access to health care is absolutely vital to our ability to get to work, care for our loved ones, and build a future for ourselves and our families. We face significant problems in health care. Plans that cost too much, deductibles that are too high, fear of being denied coverage due to pre-existing conditions, and particularly skyrocketing increases in the cost of prescription drugs. Expanding access to affordable prescription medications is one of the most important actions we must take right now. Over the past 6 years, the average price of prescription drugs, which treat a number of common conditions like diabetes, heart disease, and depression, has escalated unreasonably. Countless families across the state are worried about how they will pay for their costly prescriptions while also meeting their other financial responsibilities. I've heard from so many constituents about having to choose between meals and medicine. We are well overdue for some oversight to rein in these costs. We need solutions today. It's clear we can't wait on Washington, D.C. to fix this problem. That's why I was honored when Governor Whitmer tapped me to be a member of the newly formed bipartisan Prescription Drug Task Force. Over the next several months, we will examine the problem of high-cost drugs and the impact and make recommendation on strategies to bring costs down. We will develop transparency standards to disclose how much drug companies pay for research, manufacturing, and marketing. We will also consider policies to require pharmaceutical manufacturers to demonstrate a rationale for the price increases above a certain level. And we will finally examine economic factors along the supply chain, including spending on advertising, public research investment, and the actions of middlemen who negotiate these prices. I look forward to working with my colleagues from the House and the Senate, as well as representatives from the Michigan Departments of Health and Human Services, LARA, and Insurance and Financial Services on solutions to lighten the load for all of Michigan families. Thank you.
Thank you. And next, I would like to introduce Representative Guerra.
Thank you. Good morning. My name is Vanessa Guerra, and I have the honor of serving as the state representative for the 95th District, which includes parts of Saginaw County. We are here today because we know that Michiganders cannot afford for us to wait any longer to get serious about addressing the outrageous cost of prescription drugs. As of 2016, Michigan had the 5th highest drug prices in the nation. Bad actors driven by corporate greed have preyed on the people of our state for far too long. We know that we will all get sick at some point in our lives, and it doesn't matter if you're young or old, Democrat, Republican, rich or poor, at some point you will need to visit a doctor. And many of us will likely have to take daily prescription medicines for the rest of our lives just to stay in good health. But for far too many Michiganders, the high cost of these life-saving prescription medications make them luxuries reserved for those who can actually afford them. That's why House Democrats are so committed to lowering the costs for families and ensuring that every single person in our state can afford the medicines they need to survive. And in order to do that, we have to be focused on bold solutions. We call our healthcare package the Hope Package, because at the end of the day, that's what this is all about. It's about giving back hope to the people of this state. Hope that our system can be better, hope that everyday men and women will no longer have to worry about choosing between their prescription medication and paying rent or childcare or buying groceries. And finally, the hope that they'll no longer be priced out of receiving the medical care that they deserve. Thank you so much for joining us today, and we look forward to taking any of your questions.
And our final speaker will be Representative Hope.
And it is just a coincidence that the acronym for this package is HOPE. My name's Kara Hope, and I want to say thank you to everyone for being here today. I represent South Lansing and the communities of the 67th House District. One of the most urgent challenges facing Michigan residents is the rising cost of prescription medication. Every day, Michigan's hardworking men and women are forced to make impossible choices. Do I make my next mortgage or rent payment or buy my daughter's insulin? Do I pay to keep the lights on or pick up my heart meds? Do I buy groceries this week or an EpiPen? No one should have to face these kind of choices here in Michigan or anywhere else. That's why my colleagues and I joined together in October to introduce the Health Over Profits for Everyone, or HOPE, package to address this ongoing crisis. Our comprehensive package would significantly reduce out-of-pocket healthcare expenses while holding bad actors accountable when they try to take advantage of Michigan patients. First off, our package would cap the copays for a 30-day supply of insulin at $100. It would also empower the Attorney General to investigate changes in insulin prices. It would require all health insurers to cover the full cost of EpiPens so that no one has to risk their life just by going to school or work or trying to enjoy the outdoors. The HOPE package would also amend the Michigan Consumer Protection Act to specifically add provisions for drug makers who charge consumers excessive rates for their medicines. It would create the Prescription Drug Consumer Protection Board made up of consumer advocates, not pharmaceutical executives, to both review the prices of prescription drugs sold in Michigan and force drug makers to justify price increases. So if the price of your medication does go up, you'll know why. And you'll know that there are people sworn to protect your best interests, not the interests of wealthy pharmaceutical CEOs, and they're fighting for you every step of the way. This is our chance to make a real difference in the lives of millions of Michiganders who are just trying to access the medicine they need. Because for them, it is literally a matter of life or death. We can't let this moment pass us by. Thank you.
Thank you. This is going to conclude the formal part of the press conference.